All right, ladies and gentlemen, let's talk about lower body training with knee injuries, right? Now, I'm making this video about this right now is because every so often, which is frequent enough, people ask me what to do and what other alternative exercises they can do to work around knee pain, right? Because they have some type of knee injury. So let's get into that, right? Now, before I move forward, I want to explain, okay? There are two main types of causes of knee injuries, or any type of injury, really, right? There is acute causes, and then there's chronic causes, okay? Now, acute causes would be something like blunt force trauma, right? This can be a break in the bone. This can be a tear in a tendon. This can be a tear in a ligament. This can be all of the above, right? So let's say you got into a car accident and this is an injury that you sustained in a car accident. That's acute, right? You got into a fight, caught a nasty leg kick to the side of the knee, broke the knee. That's acute, right? You're on the basketball court. You land on the foot the wrong way. You tear an ACL. You tear your meniscus, whatever the case is. That's acute, right? Now, chronic. Chronic is caused by one or two things. It's caused by improper movement and muscular imbalance. And as these things, these improper movements and this muscular imbalance go on for a lengthened amount of time, over the course of time, it gets worse and worse and worse until it manifests into pain. Okay, so this may start off as discomfort, then tightness, then more tightness, then just pain. It may feel like soreness, it may feel like a sharp pain, right? So what I'm about to tell you, before I even move forward with that, I got to get this out of the way. I got to tell you, before we dive in here, can you please, if you're dealing with some type of pain, injury, whatever the case is, I have to tell you to go see a specialist first. All right, make sure you go and get a proper diagnosis. Obviously, I cannot diagnose knee injuries through this video, and I'm not even going to try, right? But what I can do is, after you get that diagnosis, you can look at that diagnosis and then look back at this video and see if it applies to you. Okay? Because look, if you tore something and it is beyond natural repair and you have to go get a surgery, that's a whole nother thing. And I'm not talking about surgeries here. I'm not going to talk about casts and crutches here. This is more so for people who are on their own 2 feet, but they can't really apply any pressure to the knees. Okay, so they can't really do any deep knee bending, right? So if you can't squat because it hurts your knee, if you can't lunge because it hurts your knee, but you can walk around and stuff like that, you just got to be careful. Well, then keep watching this, okay? Now, as far as muscular imbalance and improper movement patterns, usually improper movement patterns develop muscles disproportionately to others, right? And muscular imbalances feed into exacerbating improper movement patterns. So they feed each other, right? And so sometimes when you can't work on fixing the improper movement pattern because you just don't really have the muscular proportion to do it, well, then you have to strengthen those muscles, right? And I'm going to give you a way to go about that, because you'd have to hop back and forth between mobility and muscular activation and etc., right? But first things first, if you feel certain muscles are tight, like let's say your quadriceps, every time you do legs, right? Whether maybe you're running 10, 20 miles a week and now you just can't be running anymore because you're getting knee pain, or spin class. You know, when you're in spin class, you feel soreness in the knee during or after spin class, whatever the case is. Ease off the spin class, ease off the running. If the lunges are hurting your knees, ease off the lunges and focus on getting rid of the tightness and that soreness, that stress on the quadricep muscles, right? On that muscle on the front of the thighs. Because usually with this type of knee pain, it is a result of overstressed quads, overdeveloped tight quads, and tight anterior tibialis, which is the muscle that is on the front of your shin, right? So these muscles on the front of the thigh, they're tight and they pull on the knee, okay? And so what happens is this causes stress on the knee over a period of time, and it just gets worse and worse and worse. So what you got to do first is massage, get some type of myofascial release on these muscles, right? Really on all the leg muscles, right? But the ones that are the tightest may be the ones that you need to go a little bit deeper on, really dig in there and get that nice deep tissue massage, okay? And you have to do that because if the muscle is all right, it's all tight up in here, and then you're over here working it, you're not really going to be able to do so much to lengthen and relax that muscle to allow other muscles to work, right? So you got to relax that muscle. You got to loosen it up, okay? You got to get loose. So definitely, if you don't have the money or whatever right now to go to a professional massage therapist, you can get a foam roller, right? You can just go and lay on top of a foam roller and roll out your quads, right? You can, get a what is that called? A trigger point ball, right? And you can get certain spots in your quadriceps and your anterior tibialis, right? And really just focus on loosening up those muscles, right? And roll back and forth on that foam roller, right? Find those knots, right? And then focus on bending and stretching that quadricep out, really loosening that muscle, all right? And so then after you do that and you've loosened up that muscle, you can get into more dynamic movements, right? More mobility exercises. Now, the mobility exercises that I'm about to show you are going to be exercises that work on mobility as well as flexibility. Now, the difference between mobility and flexibility is mobility is more so an indication of joint degree bending, right? So the more of a bend that you have in the hip, that's mobility, right? Mobilizing that joint. Flexibility has to do with the actual stretching of muscle fibers, right? The flexibility of the muscle fiber, right? And so you want to work on both of these things together. And so some of those mobility, those dynamic warm-up and mobility exercises are going to look a little bit like this. So exercises like this, the whole point is just the fact that you need to be able to develop proper movement patterns. And in order to develop proper movement patterns, yes, you need the muscles that are lagging behind to be strengthened, but you also need the movement capability, right? If you can't properly hinge at the hip, right? Or you can't properly extend at the hip, right? If you can't properly bend the knee and the ankle and all of these different joints, if you can't properly extend at the spine, this is going to be a very difficult mission, right? This is going to be a very difficult task because you need those joints to be mobile if you are going to fix your imbalances in your movement patterns, right? So now after you do that, right, you mobilize, right? You mobilize the ankles, the knee, you're stretching out the quads and the hamstrings, glutes, and all of that type of stuff. And you're further loosening out and working on getting everything mobile, right? Working on your mechanics there. After that, then you can work on muscular activation exercises. And that's going to look a little bit like this. So the reason why these muscular activation exercises are so important is because they allow you to develop a mind-muscle connection with those muscles that are lagging behind, right? So if you have overactive quads and you have underactive glutes and hamstrings, it is because you don't really have a mind-muscle connection with those muscles. So an example would be, let's say you do a deadlift, right? And when you do a deadlift, maybe you only feel your lower back working. You only feel your spinal erectors working. when you do a deadlift, you should feel your glutes and hamstrings working more than anything else, right? So if you're feeling your lower back, it is because you don't really have that mind-muscle connection. Your nervous system is not really primed to activate and have those muscles kick in and wake up and get busy, right? And contract, stand up in that deadlift. So you just feel your lower back working. Now, obviously, the muscle is working to a degree, but it's not enough. It's not a sufficient message going from the brain to the muscle and back up to the brain. It's not that open communication there that's efficient enough to be balanced, right? So that your movement patterns can actually be efficient. So that's what those type of exercises would be for. So ideally you would do these type of exercises from anywhere from, let's say, 1, 2, 3 sets of like 12 to 16. Now, when you're doing the repetitions, even in the dynamic warm-ups, the mobility exercises, take your time with these exercises. Every rep, take your time. I can't stress this enough, right? Because I see people in the gym and they're just speeding through these exercises. They're just speeding through everything they're doing, yanking and flopping around, right? You don't want to be yanking and flopping around. Really get intimate with your body, right? Get intimate with these muscles. Feel everything that's working. Take your time, right? Because each rep you do, you should be getting a superior contraction out of that muscle, right? And the mind-muscle connection is all about the contraction, really feeling that muscle working, right? So you know, oh yeah, it's on now. And then you can move on to other stuff, right? Like lunges. Now, if you can't do lunges because of the stress that it causes to the knee, well, you can modify lunges. And modified lunges really shift the bend from the knee to the hip. So the knee only bends slightly, but the hip bends a lot more, right? And so a good example of that would be exercises like this. So you can see the resemblance between these different exercises, right? Where you get to see the regular lunge and then you get to see the modified version, right? Now, basically all these really are mostly unilateral hip hinging exercises. And the thing about these type of exercises is because they also work on flexibility and mobility as well, especially in the hamstrings and adductors, right? While also having the glutes and hamstrings work in unison the way they're supposed to. The only difference with the modified version is there's not as deep of a knee bend there, so you don't got to worry about the excess knee stress that would result in pain. Now, if you're having a difficult time doing these exercises where you can't keep your back straight, right? Because really when you're doing these exercises, you're not really supposed to be rounding out at the spine. So if you have a habit of really rounding out at the spine, you're really bowing out and you don't really know how to extend at the spine, you can do a very good dynamic exercise. It's more of a dynamic mobility / flexibility / stability exercise, right? And before doing these modified lunges, you can do an exercise that's going to look like this. So once strengthening these muscles that are lagging, once you work on improving your mobility and your flexibility where you need to, you will see a drastic change, right? Because you come back stronger, more balanced, fuller muscle. You come back with better movement quality. And these type of exercises also help you to facilitate the healing process, so you heal quicker rather than just sitting on your biscuit not doing anything at all, right? So we always want to move forward. We always want to think progress. We always want to work towards a solution, right? And so what I did was I created a whole training guide specifically on this topic, right? How to rehabilitate the knee and strengthen all the muscles around it so that you can come back better, right? And I put that over at tribenoir.com for the members over there. So if you're interested in getting that full lower body training with knee injuries training guide, definitely head over to tribenoir.com and become a member. Not only will you get full access to that training guide and all the workouts and everything within that training guide, but you'll also get all of my other programs, training routines, training guides, meal plans, nutrition guides, grocery guides. There's all types of stuff that I have in there, and I'm always updating the platform. So definitely, if that interests you, you know what to do. Head over to tribenoir.com and become a member, and I'll see you on the other side. You take care, guys.